Welcome back to the deep dive. Really excited today. We're looking into something quite vital. Sterility testing. Basically how pharmaceutical products get this intense check to make sure they're safe, free from hidden nasties. Consider this your quick guide.
Yeah, it's fascinating stuff. These tests are kind of the silent guardians of public health, aren't they? They ensure the medicines, the devices, even bandages we use are genuinely clean, completely free from microbes.
Okay, let's unpack that. We hear sterilization a lot, but sterility testing. What's the difference there? Is it just about cleaning?
Good question. It's much more specific than just clean. So sterilization is the process, like actually killing off all the microorganisms. Sterility testing, though, that comes after. It's the check, the crucial verification step to see if the sterilization actually worked or if anything slipped through or got back in. We're talking about confirming a complete absence of any living thing. It's a really high standard.
A complete absence. Okay, so what exactly are you looking for? And I mean, what happens if something fails that test, if it's not sterile?
Well, besides looking for any live bacteria or fungi, a huge concern is something called pyrogens.
Pyrogens.
Yeah, fever-producing substances. If they get into your bloodstream, they can cause serious reactions. We're particularly worried about endotoxins. These aren't live bacteria themselves, but they're bits of the outer membrane of certain bacteria released when the bacteria die. Tiny toxic fragments.
Okay, I see, like little chemical alarms.
Exactly. And if a product isn't sterile or it contains these endotoxins, the consequences are severe. You're looking at recalls, potential harm to patients, a huge loss of trust. The stakes are incredibly high.
Right. Now, something in our sources really caught my eye. This rabbit pyrogen test sounds a bit old school. What was that?
Oh, the rabbit test. Yes, that was an earlier method. You'd inject the test solution into rabbits intravenously and then monitor their rectal temperature. Rabbits have a very sensitive thermoregulatory system, so they react quickly to pyrogens with a fever. It was relatively inexpensive back then.
So they literally use rabbits to check for fevers.
They did. But thankfully, it's largely been replaced now by the bacterial endotoxin test, or B-Day. Much more specific, more ethical, too. No rabbits involved today.
That's good to know. So, putting the rabbits aside, why is this level of testing so crucial across the board today? What's the big picture?
The why is everything, really. These tests are essential to detect any surviving bacteria, fungi, yeasts, anything viable that could cause infection or harm. It's the final quality check before a product goes out. It protects against contamination and ultimately ensures patient safety, your safety.
And it's not just for things like injections, is it? What kind of products need this?
Oh, definitely not just injectables. The range is huge, actually. Think injections, yes, but also implants, syringes, bandages, surgical dressings, instruments, needles, even things like bulk solids before they're formulated, and ophthalmic products for your eyes.
Wow. Okay, so pretty much anything that goes in or on the body in a medical context.
That's a good way to put it. If it needs to be sterile, it likely gets tested.
So how do they actually do it? It sounds like you'd need, well, an incredibly clean space.
You absolutely do. Extreme precision is key.
Yeah.
The testing happens in specially designed aseptic rooms. These rooms have ventilated, filtered air, bacteriologically cleaned air to prevent any accidental contamination from, the environment itself.
Oh, like a clean room.
Exactly. And the staff performing these tests, they need to be highly trained, meticulous. Plus, the working conditions themselves are constantly monitored, sampled, checked. It's intense.
Okay, super controlled environment. Then what about the actual test materials? How do you coax any potential microbes out of hiding?
Right. That involves specialized growth media. Think of them as like a specific nutrient broth designed to encourage anything that might be there to grow. There are different types, for instance, fluid thioglycolate medium or MTM. That one's great for anaerobic bacteria, the ones that don't need oxygen but catches aerobic ones too, often used for clear liquids. Then there's soybean casein digest medium, SCDM. That's better for fungi and also aerobic bacteria, and it's often used if the product itself is cloudy or thick. And these aren't just mixed up casually. The pH has to be exact, like FTM needs to be pH 7.1, give or take 0.2, SCSM pH 7.3, plus or minus 0.2. Then they're sterilized themselves, usually by autoclaving at precisely 121 degrees Celsius for 20 minutes. Every detail matters.
That level of detail is incredible, even down to the sample sizes mentioned in the sources. Why specify exactly how much to test?
It all comes down to reliability and standardization. You need results you can absolutely trust every single time. So yes, the guidelines specify everything. The number of containers to pull from a batch, say 10% of containers for injectable batches up to 100 units, or the exact volume of liquid to test maybe 2 milliliters if the container holds between 5 and 20 milliliters. This rigidity, this standardization ensures the test is thorough and the results are meaningful for safety.
So wrapping this up, what's the big takeaway for us, for the average person using these products?
Well, I think the main thing is realizing the sheer amount of sort of invisible scientific work that goes into keeping us safe. From a simple bandage to a critical injection, there's this incredibly rigorous process ensuring it won't cause harm due to contamination. It's quite something. And maybe it makes you think, how does knowing about this intense scrutiny for medical sterility affect how we view claims of safety or purity for other products we use every day?
That is a fascinating question to ponder. Thank you for taking us through the hidden world of sterility testing today. And thank you for joining us on the Deep Dive.